It is my honor, privilege, and pleasure to introduce Vice Admiral Vivek Murthy, the 19th United States Surgeon General. As America's doctor, Dr. Murthy is responsible for communicating the best available scientific information to the public regarding ways to improve personal health and the health of the nation. He also oversees the operations of the United States Public Health Services, or USPHS, Commission Corps. Dr. Murthy has devoted himself to improving public health through the lens of service, clinical care, research, education, and entrepreneurship. The son of immigrants from India, Dr. Murthy discovered the love for the art of healing early in his childhood, while spending time at his father's medical clinic in Miami. After attending Miami Palmetto Senior High, he received his bachelor's degree from Harvard and his MD and MBA degrees from Yale. He completed his residency training at Brigham and Women's Hospital and Harvard Medical School, where he later joined the faculty as an internal medicine physician and instructor. In addition to clinical practice, Dr. Murthy has 2 decades of experience and perspective improving health in communities across the country and around the world. He co-founded Visions, an HIV/AIDS education program in India and the United States, which he led for 8 years. As president, he established 10 chapters with hundreds of volunteers in both countries and grew the organization's education programs to reach more than 45,000 youth. Dr. Murthy also co-founded Swasthya Project, which means health and well-being in Sanskrit. It's a community health partnership in rural India to train women to be health providers and educators. During his 5-year tenure with the organization, he established seed funding and it helped expand research and direct care programs, then reaching tens of thousands of rural residents. As a research scientist, Dr. Murthy has conducted lab research on vaccine development and studied the participation of women and minorities in clinical trials. His research findings have been published in Science, the Journal of the American Medical Association, and the Journal of the National Cancer Institute. Dr. Murthy is also a healthcare entrepreneur and innovator. He co-founded and chaired a successful software technology company, Trial Networks, which improves research collaboration and enhances the efficiency of clinical trials around the world. And in 7 years, Dr. Murthy and his team took the company from conception to an international enterprise that powers dozens of clinical trials for over 50,000 patients in more than 75 countries. Dr. Murthy firmly believes that our nation's greatest strength has always come from its people. Improving the health of our people means strengthening our communities and our country. That focus will be his highest priority as our 19th Surgeon General. And Dr. Murthy, as I invite you to the stage, in such a short time, we are very impressed with what you've already done and the passion that you've used to evoke such camaraderie in our country. And Eliza and I were very excited and inspired to attend the change of command ceremony. And just from that one experience and looking to see what you've done in just a short space of time that you have, we know we're in the greatest of hands, and you will turn the tide in the favor of our nation's health. So it's my honor to present to you the AMWA Presidential Recognition Award in honor of all that you do.
Thank you so much. And thank you so much for that warm welcome and the kind introduction. It is wonderful to be with all of you. And I'll tell you why, because I came to know of AMWA actually years ago when I was working initially on building Doctors for America, the organization I worked on prior to being Surgeon General. And when we were looking for organizations that would be partners, that would not be afraid to stand up on issues that might be controversial, but were important, issues where the voices of physicians were critical, we found AMWA. And we had the opportunity to start working with Eliza years ago, and we love her. My fiance absolutely loves her, and so she has a lot of fans. But I do want to say that I've certainly been a fan and a supporter and admirer of AMWA for a long time. And so I think it's very special to be here with all of you today, especially on the 100th anniversary of AMWA. And as I was reading about the history of AMWA and getting a better sense of your founder and some of the work that you did, it's really been quite impressive to learn about, from working to make sure that there were more women represented in medicine, to working on the issues that you're focused on now, around alcohol, around prevention. These are important issues, and I know that while you have focus areas, that you are not defined entirely by those areas, but that you also step up when you are needed on issues as they arise, as you did so often during the Affordable Care Act, during the work that we went into getting that law passed. So thank you for the warm welcome, and again, it's especially meaningful for me to be here at a special time for you. But I also lastly just want to make sure that I acknowledge the work that you do, not just in AMWA, but that all of you do every day to care for patients, to make lives better for people in your communities. Sometimes I know that you may not hear thank you enough for that work. I know it can feel incredibly frustrating at times, and I know that being a clinician who has spent a lot of time with patients in clinic and on the inpatient side, feeling frustrated that the problems I'm seeing in front of me were probably preventable, but that I'm feeling like I didn't have the tools to actually help people change their lives and prevent illness. I know that many of you struggle with that in your own practices every day, but you find a way to keep going to work every day and providing care to patients. So I thank you for that. And I especially want to acknowledge our medical students and our residents who are here in the room today, because I know that if you read the papers, that you hear people say, oh, this is a terrible time to go into medicine. If you have the chance, get out while you can. You see these polls of where they ask doctors, would you do it all over again? And you hear a majority of people saying no. Now, those are skewed polls, and I think the issue is much more complex than that. But I think what excites me and encourages me about the future of healthcare in this country is actually our medical students and our residents, because I see people who, despite the naysayers out there, who despite the negative press, find that there is a compelling reason to still pursue medicine and to pursue a career and a calling of caring for patients. And that's what all of you are doing. I think it's especially important because your innovation, your creativity, your ability and willingness to think outside of the box could not be important and more important than it is right now, a time where we really need transformation. So I thank you especially for being here and for your involvement in leadership. As I look out at all of you, I can't help but think that all of us have come to medicine in different ways. We have individual stories, unique stories. We have challenges along the way. And a couple of days ago, when I was doing our swearing in and change of command ceremony, I had a chance to reflect on my own story and the path that brought me here. I will say that I feel incredibly privileged to be able to practice medicine. I feel just really lucky to have the opportunity to have been a part of patients' lives and witnesses on their journey from illness to health. I seek certainly to, like all of us do, to help patients to get better and to live more fulfilling, more healthy lives. But the opportunity that we have to be witnesses as people go along their journeys, to learn from them at incredibly poignant and reflective moments in their life is absolutely extraordinary. When I was building Doctors for America, I was also building my technology company, and I had many friends who told me, why don't you just give up clinical medicine for a little while and let you focus on the other two things? And I always told them that while that would be easier, it would actually be harder because it would make sense in terms of time, but it would not make sense in so many ways because medicine was like my fuel. It gave me the passion to pursue the other things that I was doing. It also grounded me because, as all of us know, having seen patients and practiced medicine, you never learn it all, and you're always humbled each time you get back into the hospital or the clinic because you realize there's actually a lot more to learn and that not everybody follows the textbook in terms of their illness. So, I've continued to do it, and I feel incredibly privileged. But my inspiration and the whole reason I'm in medicine really goes back to my parents, because my family, when I was very young, they gave me my first exposure to medicine. My parents came to this country when I was 3 years old. and when my sister was 4. They didn't know anybody, they didn't have much in the way of money, but what they did have was an extraordinary excitement about being in America. They had traveled from India to England with stints in Ireland, in Wales, in Scotland, even in Libya, in Newfoundland, and then they eventually made it to the United States. But the reason that they kept trying to come to the United States was because they believed that this country, more than any other country in the world, was a place where people would be judged by their ideas, by what they could do, and by their experiences, and not based on where they were from or what they looked like. And while we have certainly more work to do when it comes to equality in the United States, I am proud to say that the reason that I have this opportunity to not only be a physician, but to serve as Surgeon General is because of those values that our country has, and because of the opportunity that it has afforded to so many immigrants and their children, like my parents and myself. So I'm very grateful for that. I also want to say just that one of the things that was very important to me along the journey was having strong role models who were women. And those were, for me, my mother and my sister in particular. My sister is a family physician. She practices in Miami with my father. They're both family doctors. They practice together, so we say they have a family practice. And it was actually, they had been talking to me a lot about joining the practice, and I was thinking about it and gone through the process of applying for a Florida medical license and everything, and then I got a call about a job, you know? So here I am. But I think they're going to ask me again in 4 years to come down and join the practice. But I want to say that my mother and sister were absolutely critical. And yesterday and on Wednesday when we had the swearing in, we were certainly honored to have Vice President Biden there. And at one point after the ceremony, he pulled my mother aside and he said to her, I want you to know that you're responsible for a lot of this. And he said, I want to tell you why. He said that he had found that any man who is truly successful and is able to build relationships with people and build good partnerships usually has a strong woman in his life who has guided him from the very beginning in how to build relationships and how to treat men and women and in how to be respectful. And I was very grateful that he said that to my mother, because I think moms in particular don't get enough recognition and thanks for the incredible sacrifices that they make. But I feel very grateful to both my mom and my sister, and of course to my dad as well. But without them, I certainly wouldn't have the opportunity to be here. I want to say a little bit about where we are as a country, and I want to say a little bit also about where we could go and the role that I'm hoping you can play in taking us from where we are now to where we need to go. The challenges that we face as a country are familiar to all of you. To those of you who work in clinics or who are in the inpatient side or who do both, you know that we face great challenges when it comes to obesity and chronic diseases like diabetes and cardiovascular disease. You know that we face a growing problem of substance abuse, not just illicit drugs, but a growing problem with prescription drug abuse that in many cases is feeding in to our heroin epidemic. And you also know that we face great challenges when it comes to mental health, where we have, despite so much advocacy and work in this area, we still have a persistent stigma that is associated with mental illness, which is not only unacceptable, but it prevents the majority of people who have mental illness from coming forward and actually getting the care that they need. And that's a tragedy, especially when we look at our prison system and we see that so many of our incarcerated Americans suffer from mental illness. And obviously the ideal place to be getting them care is before they run into trouble and not after. So we face these challenges, and these are well known to all of you. But the point that I want to make tonight is that we cannot solve these problems by building more hospitals, building more clinics, and training more doctors alone. While we may have to do those in some circumstances, the only way we're going to really solve these great challenges that face America is by building a culture of prevention in this country. It's by ensuring that our society is built on the premise that all of us have a stake in health, and as a result, all of us have a responsibility to improve health. And that's not a difficult premise to understand, because if we look at how health impacts every sector in this country, from employers to schools to civic organizations and certainly to hospitals and clinics, the impact is relatively clear. But I'll tell you what's not clear, What's not clear is how non-traditional, non-health sectors can actually play a role in improving health. If you go to your community and you knock on the doors of small businesses and you ask them, do you think it's your job to improve health in your community? Most of them will probably tell you no. Not that they don't care about health, but they're not sure what role they should play in actually improving health. The same is true in other sectors as well. But what we have found, and what I have certainly found traveling around the country these past few months, is that the role that non-traditional sectors have to play in health is actually critical. Because if you think about the experiences that many of you have had, and that I have had, of being in a room with the patient and trying to explain to them the proper diet, the proper activity that you think that they should have, you come to a point where you realize that you are probably not the best person to be having that conversation. And that's not to say that doctors and medical students and nurses shouldn't talk about lifestyle change with their patients. They absolutely should. I want to be clear on that. But what I do mean to say is that we are not always the most influential or effective people to change behavior. And I think all of us know that, given our experiences. This is not news to any of you. But the question then is, who is? And if our goal is to build a culture of prevention, if it's to build a foundation for health that runs through every sector of our community, we should just think about ourselves. Like if you think about your own life, who influences your choices about what you eat? Who influences whether or not you go to the gym, whether you choose to walk or get in the car? A lot of times it's your family, it's your friends, it's what you see people doing around you in school or in your workplace. It might be what you hear at church or synagogue or at your mosque or your temple. It's factors in your community that, it turns out, influence some of the most important lifestyle and health decisions that all of us make. So it only makes sense that if we want to change and address the big healthcare challenges that we're facing, that we have to engage these partners in the community. And the question is, how do we do that? Well, I'll tell you that I got a lot of tips over the last few months because I've been on the road traveling as part of a listening tour. And I wanted to start off my tenure as Surgeon General with a listening tour because I firmly believe that there's a tremendous amount of innovation that is happening in the community at a grassroots level. And we don't hear about it a whole lot in DC, although we do to some extent. But I wanted to get out and hear directly from people about the challenges that they were facing, but also about the ideas that they were implementing. And I heard a number of wonderful things, some of which I'll share with you today. I found that there were three main areas where people were having some degree of success when it came to improving health. The first was in taking care to where people work. That was based on the recognition that not everyone's going to come into the hospital or the clinic for their health care or for their preventive education and services. And what we need to do more and more is make sure that we're taking care to where people are. These are the community health worker models that I heard about in Ohio, where they were seeking to get care to some rural populations in the Appalachian part of the state, where they felt it was actually very difficult for people to actually come out and actually get care. But these were also the mobile medical clinics that I heard about, which were going to schools and providing education and basic care. The second category of interventions that I heard about were those which focused earlier and earlier in the life cycle. These are the programs that focused on identifying pregnant moms and providing them with a variety of services, from food to actual medical care to education about how to care for themselves during pregnancy. These were also the programs that went into schools and taught kids about healthy fruits and vegetables. There was one program I came across in Roanoke, Virginia, which was teaching kids about healthy fruits and vegetables, not just by showing the items to them, but they were actually getting them to taste the fruits and vegetables. And they recognized that the kids had to prepare something with the fruits and vegetables to really remember them. And what they had done is they assessed kids' preferences at the beginning and at the end. And they found in the beginning that the kids usually had the big three on their list, which were hot dogs, pizza, and macaroni and cheese. Not shocking. But at the end, they found that some of those items had changed, and they had swapped out. And kids had, in fact, replaced them with the items that they had tasted. And then what they would do is they would go home, and then they would ask their parents, can I have that, whatever the item was, that they had me try at school? And then the parents would say, well, I don't know how to make that, I don't know where to get that. And then the school would help the parents learn about how to make those foods and where to actually get them. So these were wonderful interventions. And then the third category of interventions I heard about were those that were seeking to build cross-sector collaborations. And these were collaborations with sectors that didn't have health in their name, but which had an outsized role to play. One of these I remember was in Richmond, where the Department of Health there had decided that what they were going to do is when they were trying to figure out where to focus, they said, we'll find the areas where we are more than twice as worse off as the rest of Virginia. And when they did that, they found that it was in sexually transmitted infections, it was in percentage of kids who were born to a single parent, it was in infant mortality, it was in a number of factors that they felt in some way or the other were influenced by the strength or the weakness of the family unit. And so they built what was called the Richmond Family Fatherhood Initiative, with the intent of creating stronger, more responsible fathers who could be there to support mothers and support children. And in this effort, one of their first meetings, they had over 200 pastors who came together to help and who wanted to be a part of this. And so they brought in a whole other sector. And then they started working with the juvenile justice system, realizing that rather than pouring $100 million into building a new detention facility, that maybe it would be, if we could invest some of that money more upstream and helping people earlier in their life before they got into trouble, that we might be able to actually save on some costs down the line. So these interventions were great, but what we realized also, and what I heard a lot on the road, is that it wasn't easy to create interventions that fell into these three buckets. Communities struggled with how to fund them. They struggled with how to evaluate the work that they were doing to know whether it was truly having an impact or not. And they also struggled at times to convince some of the other sectors that they actually had a role to play, whether it was convincing transportation that they were actually essential for people to be able to get to the clinics and to their appointments, or there was convincing folks whose primary job is around job creation that actually economic development is a critical part of improving health and of public health in general. So these are some of the challenges that they faced. But when I think about how we are going to scale, about how we're going to go from some of these examples that are out there, that are isolated but that are working, to a broader culture of prevention and cross-sector collaboration, I do think of all of you. I think of the physicians in our community who are open to thinking about health in new ways, who recognize the urgency that we have in addressing the healthcare challenges that are in front of us, and who want to be a part of the solution. And that's where I think you have an essential role to play, which is that we have to transform the country in several ways. Speaking of the House of Medicine, we have to transform our profession, and we have to ensure that we are training the next generation of physicians, and even the current generation of physicians, to not only think about the patient that is in front of them, but to recognize that we have a broader calling and a role to improve the health of the community as well. And that involves partnering with community organizations. It means understanding how different community factors impact health, and then being a part of that solution. I'm not talking about one class on a Wednesday evening that people attend for one semester during medical school. I'm talking about shifting how we think about our work as physicians and incorporating that into our training at all stages of being a doctor. This is an area where actually we could use your help, because one of the areas that I laid out that I would like to focus on is ensuring that we are powering and pushing this transformation in education forward in the health sector. And that includes training not just for doctors, but for nurses, for pharmacists, for others as well. The other couple areas I'll just mention that we would love to have your help on, where I think you could make a difference, is in actually engaging our educational institutions in being models of health. We think about schools and we think about college campuses as places that give young people a foundation that they can use for the rest of their life. And why shouldn't that be true about health as well? Because the truth is that we know people develop habits early in life, and the more our educational institutions can be forces for making sure that those habits are good habits, the more they can be models for good health, the better off we will be. And that means not only ensuring that we have nutritious choices and that we have as well a culture of physical activity in our campuses, but it also means ensuring that our campuses are tobacco-free. And we have 25% of campuses in America right now which have gone tobacco-free. That's good. That shows us it can be done. But there's no reason that we can't get to 100%. And if we can do that, then we can make a dent in the scourge of tobacco-related disease that we face. But the last area that I wanted to mention to you is about an area where culture change is especially important, is with regard to mental health and violence. And with regard to these areas, we can't simply pass policies or put in place regulations and expect that that's going to solve our entire problem with mental illness and with violence. But we need to shift our culture in ways that make it acceptable to talk about mental illness, but that also make violence, especially violence against women, absolutely unacceptable. And the question is, who can do that? And one of the groups that we want to work with are faith leaders who can help to bring mental health as well as violence against women into the conversation more. So it's not something that we shun away from, but it's something that we actively talk about. And we do what responsible, mature families do, which is we look problems square in the face and we figure out how we're going to address them. And that's what we have to do with mental health. That's what we have to do with violence against women. So these are areas which we will be working on from the Office of the Surgeon General. These are areas where we could certainly use your help and your partnership as educators in your community, as people who can partner with community organizations, faith leaders, college campuses, schools, as I mentioned, and educational institutions in the healthcare professions to help them move along the transformation that is so desperately needed right now. And I'll finally, just in closing, share one last thought with you, which is that when we think about where we are right now, it's sometimes easy to lose sight of what a profound moment this is in our nation's history when it comes to health. We have been struggling with problems related to the uninsured for decades, and we have, within a short period of time, covered millions and millions of people through the Affordable Care Act. But we've also been struggling with many other challenges, whether it's around quality of care, whether it's around the need for more prevention, as I talked about. But while the challenges we have are great, I am also so hopeful that we can meet these challenges because of the people that I meet all over the country, including people like you, health professionals, patients, community members, people across the country who want to be a part of the solution, who came to the work they do because they want to help people live a happy, healthy, prosperous life. And that's what gives me hope. That's what makes me feel that we can actually do this. I was talking to one of our leaders in the medical profession some time ago, who was from Washington State, and she shared with me a very personal memory to her, which is of how when she was young, she attended the March on Washington that Martin Luther King organized. And I was sat there for a moment, and I just paused, and I thought, what would it have been like to have been there? To know that you were part of this extraordinary moment in history where the country was going to change in ways that weren't easy, but that were going to take us to a better place that was more consistent with our values. And it struck me in that moment that we are also in a special time here, where when people look back in 20 or 30 years, they will see that this was a time of great change, of great confusion, but of great possibility, where people finally started taking on and addressing and confronting some of the great healthcare challenges that we face. And we're struggling to figure out how to address them. And the question is, what story will be written from here? The question is, what do we want to be able to tell our kids and our grandkids in 10, 20, 30, 40, 50 years about what we did during this transformational moment in history? Well, I know what I want to tell them. I want to be able to tell them that despite the fact that there was great confusion and great controversy around health, that we stood up to help the community understand what was going on and to be a part of a larger solution. That at a time where our country was so focused on treatment and where we didn't focus enough on prevention, that we recognized that there was a need for a much broader transformation in culture, one that couldn't be engineered by us alone, but that would require partnerships that we could help build, and that we went out and that we built those. And I want to be able to tell my kids and all of our kids that at a time where so many people were suffering with chronic disease, with mental illness, from substance abuse and addiction issues, that we stepped up and helped to build a stronger foundation for the country that not only improved people's health, but that contributed to stronger communities and to a stronger country. This is a story that I want all of us to be able to tell our kids and our grandkids. And this is the opportunity that we have right now. And that's why over these next few years, I'm not only deeply honored to have the opportunity to serve as Surgeon General, but also incredibly privileged to have the chance to work with organizations like AMWA that have been leaders in the past and will certainly continue to be leaders in the future. Thank you so much.